At a September 2006 press conference introducing Maternity Care Coalition's report on the status of health care for childbearing families, Executive Director Joanne Fisher made some sadly prophetic remarks. Childbirth is at a crossroads. If we continue on our current path, families will not be able to count on having a hospital in their community, nor a trained practitioner for their birth. We are no longer at a crossroads. We are facing a maternity care crisis in Philadelphia. How can this be? Sue Rosenthal and the Community Board of Health Center 10 have been looking for answers.
5,596 births in Northeast Philadelphia in 2005, which is the latest data that we have been able to get. That means that there's no place to have babies here. Oh yes, there is one place, Northeastern Hospital, at the southern tip of Northeast Philadelphia, which has, for these 5,596 births, 22 licensed beds. This is a crisis. Another problem is because some people have said, well, why can't they go to the suburbs? Why can't they go to Abington? Why can't they go to Holy Redeemers? Both very, very fine hospitals. But if their particular health insurance plan does not have a contract with those hospitals, they cannot have their babies there.
With high-risk pregnancies and the often unpredictable timing of childbirth, every second counts. For Melissa Green, timing was everything.
I kept bleeding and bleeding. And my mom put a blanket in the car for me to sit down on, and I was just like really upset. We drove really quickly over to the hospital, and he came out along with a couple of other doctors, and they took me in the back, and they must have like put me out like right away. So I don't know if we could have driven that far to get out to another hospital with the problems that I was having. So that's why it was so important that Jean's was there, and my doctor was there too. I mean, things couldn't have worked out better for us.
Fresno Phelps' journey to give birth was quite challenging.
When Jean's closed, all of a sudden I was already pregnant, and there was so little notice. And they didn't give enough time for anybody. I tried going to Holy Redeemer, and they didn't take my insurance. They only took Health Partners or something like that, not Keystone Mercy. So then I tried Abington. I heard from somebody that they had like a 3-month wait, and I was already like 5 months. And I tried calling them a few times anyway, and I left messages, and I never even got a return call. And I tried downtown. Some people in my community were going to University of Pennsylvania, but it's very far away. Parking is very difficult, and I was nervous that if I would choose a provider there, that I wouldn't make it in time because I have fast labors and deliveries. So I didn't really feel comfortable going so far away. Also, once I finally decided, well, I'm getting stuck here, maybe I will look into it, I called and they said, oh, we can't take you. You're way too far along in your pregnancy. In the end, I had to choose a clinic through St. Mary Medical Center, and it was a half an hour away from my house. And so every appointment I went to, I had to schedule in a whole hour just for travel time. At times I thought, well, maybe prenatal care is not so important. Maybe I can just go to CVS and take my blood pressure and weigh myself at home and buy a home Doppler. But in the end, I went, I managed, and thank God I have this precious little bundle over here. So it worked out, but it certainly wasn't fun.
And if working families with health insurance face these barriers, what happens to those with limited resources? Mom Mobile advocate Kayla Kenyatta knows.
We have seen that our clients in general are having many concerns regarding the long wait times for prenatal care, which has been creeping up more since the closing of Jean's. And we have also seen a concern with traveling distances. We do have lots of women that tell us, well, how do I get there on SEPTA or public transportation? So it's very difficult for these women to access good quality of care when they have to travel farther distances or they have to wait a long time for prenatal care. Also, their concern is, where would they go if they were to call the ambulance? Where would the ambulance take them? We have had clients and other women have that concern because an ambulance would take them to a hospital where there's no record of them. So a lot of these women may end up with C-sections, unnecessary C-sections, or unnecessary procedures.
Midwife Pat McCauley Sunday used to work with women giving birth at Jeans. She knows firsthand how closing the OB unit impacted families, practitioners, and the community.
Yeah, getting ready at home. When the decision was made to close Jeans, both myself and the staff were devastated. There were only 11 of us here. It's a small unit. There were 9 docs, 2 midwives. Of the 11 of us, in the end, 4 of us lost our obstetrical practices. What was more devastating is what happened with the patients. I had 70 pregnant women that I had to scramble in 1 month's time. Practices are already busy. How many practices want to take on that kind of responsibility at the last minute, saying, yes, I'll take on 5, 10, 15, 20 pregnant women already in the middle of a pregnancy when they're already overworked? I think there's a number of concrete barriers right now to patients who want to extend their families. Number 1 is insurance issues. Number 2 is the facility of their choice. They can't seem to deliver in their own communities anymore. Number 3, they're not getting their provider of choice any longer. There is such a lack of respect for families in this culture anymore. When you can pay more money out for other kinds of surgeries and other kinds of medical problems, and you cannot pay for family care, for maternity care, for things geared towards health care for women and children.
And what about the hospitals that are left to bear the brunt of the closures? Dr. Arnold Cohen is chairman of obstetrics and gynecology at Albert Einstein Medical Center.
There's only 8 hospitals in the city of Philadelphia still delivering babies. Every one of those hospitals, or almost every one of them, has had an increased number of patients coming in, and every one of them is going through the same thing that we are having at Einstein. Increased number of patients, increased number of people not getting prenatal care, increased number of people coming in who have received prenatal care someplace else, so we don't have all the records. It just makes it more difficult to take care of the patients. But now, instead of receiving their prenatal care close to home, they have to travel. They have to take buses, they have to take public transportation other ways. They miss appointments. We've had more people missing appointments because of how difficult it is to get to our clinic. We have tried very hard to get everybody in within a week of telling us that they're pregnant, but it becomes much more difficult to get to the services. It certainly has an effect not just on Einstein, it's affected Temple, it's affected Holy Redeemer, it's affected Abington, all of the other hospitals, but the hospitals outside of Philadelphia don't necessarily take the Medicaid patients, and they're busy as is, and transportation to those suburban hospitals is certainly not as easy as getting transportation to Broad and Olney. There is no other place that I know of where there's been such a closure of obstetrical units in hospitals that's put pressure on each one of the remaining hospitals to this extent. So we need relief. We are certainly an underserved area. There are programs that the federal government has for underserved areas, but they haven't recognized Philadelphia as an underserved area for obstetrical care. The governor and the state legislature has to address the malpractice issue. The governor has stated there is no crisis in Pennsylvania. That's absolutely wrong for obstetrics. It may be in other areas that the crisis is lessened. But in obstetrics, the fact that we have lost 14 hospitals in the last 10 years doing obstetrical service, and we only have 8 hospitals, and every one of us is overcrowded, tells us there's a crisis.
Today, families in Northeast Philadelphia are most affected by dwindling maternity care options. What lies ahead for other communities?
Same thing that happened at Jeans is happening everywhere else now. The volumes are increasing. Patients are laboring in hallways. The staff is insufficient. And patients are becoming numbers. More and more, these hospitals are too small to accommodate the increased workload. There's too many patients for these facilities that are left that have maternity care. If we don't see a change soon in the reimbursement and the physical spaces, they're not going to have any choice but to continue to close maternity centers.
The hospital is here because of our mission, our commitment to the community, and our mission and commitment to medical education. If we were doing it on a business standpoint like the rest of the world operates, we wouldn't be in the obstetrical business. And that's where those 14 hospitals have closed, because they have determined that they make more money doing some other service as opposed to obstetrical care.
It is about making the baby business profitable. Every person I've talked to who is in an administrative or a financial role has said that they lose anywhere from $2,000 to $4,000 per patient in a maternity unit. I don't understand the financial end of that. I don't know how or why that happens, but that is a quote that I hear constantly. Maternity is a money-losing department, and hospitals are big business.
Where do we go from here?
I'm hoping that what will happen is we will form an organization that will talk about the problems, not point fingers, because everybody can point fingers in this situation, but instead look for some kind of answer.
I think to ensure healthy births and healthy babies in Philadelphia, there definitely needs to be a joint effort between the community, a lot of support from different agencies, support from family and friends, and we definitely need to put more pressure on different levels of government, local, state, federal, because we need to push for more funds for prenatal care, more facilities, and more funds for hospitals. And also more funds for these women regarding insurance. A lot of these women are left without insurance, so that becomes a problem. So definitely it needs to be a combined effort between a lot of people.
Women do not deserve to have this burden on their minds. Where am I going to have a baby? Am I going to get there in time? Is the baby going to be healthy? If the baby's born in a car or a cab or a bus, is that because I can't get to a hospital in time? I would like us to be able to work together to solve this problem. Let's do it.
I don't want to see like another pregnant woman, you know, have to go through what I did.
Now is the time to bring the voices of childbearing families to the table.